NHS Trusts up and down the country are dealing with backlogs and ageing equipment. Tell me how TIC's equipment rental service helps a trust facing that picture.
Yeah, so we're a mobile diagnostic imaging provider, and so we're able to provide rapidly deployable diagnostic solutions. Our typical modalities are CT, MRI, X-ray, ultrasound, and the idea is actually if you had very sudden unanticipated downtime and you needed to maintain capacity, we can have a mobile deployed within 24 hours. So we can return that capacity immediately to take the heat out of the emergency situation, prevent patients from being cancelled. Similarly, you might have some old outdated equipment in your department and you're planning a replacement program. That can take 3 to 4 months, but you can't afford the downtime. So again, you can bring in one of our solutions, we can plan that in. We offer relocatable solutions as well as mobiles, which are ground level units like the one here with ramp access and a bit more space for staff. So more appropriate for diverting inpatient capacity through with ramp access. And we can even do things like connecting corridors, so they're connected to the main building. So it means that your staff internally have access to a scanner. What we can do that can be quite exciting is if you're planning an upgrade to a new type of scanner, let's say a different modality, we can select a scanner that's as close in specification to the one that you're putting in your department, and we can provide applications training all the while, so that while your replacement program is going on, your staff are also being trained on the new equipment that you're going to end up with in the department. I suppose the final way that we can support is, like you say, with backlogs. In some instances, a trust has a requirement for additional capacity, and the build program for a new imaging department can take 2 to 3 years sometimes, especially with planning permission and restrictions around that. So what we can do is we can provide an interim solution where we will bring something like a relocatable MRI or CT in. Much like how I described a moment ago, we can connect that to the main building even in some instances, so you feel as a patient like you've not left the building, and that will give you that additional capacity while you're planning and completing the building work that needs to go on to increase the overall capacity for the trust. So lots of different ways hopefully that we can support in that setting.